Welcome back to Living Local. September is National Suicide Prevention Month, and the experts at Vera Community Mental Health Center are working to raise awareness of the importance of suicide prevention. And joining us today is Dr. Rich Whitaker, CEO of Vera Community Mental Health Center, which is also this segment sponsor. Dr. Rich, how you doing?
I'm doing great, thanks.
Thanks for being here today. So, looking back, people were really struggling during COVID with suicide and depression. Is it still a problem? Are numbers still high?
You know, unfortunately, I think depression, anxiety, even death by suicide will always be with us, and those factors have been actually a little more prevalent since the pandemic.
Really?
Yeah, our rates are still here in the Quad Cities higher than the national average, unfortunately.
Oh no.
Yeah.
That's not good. That's not good news. So sometimes it can be really obvious when someone's struggling to cope. Sometimes the signs are just a little harder to spot. What do you recommend to someone who has a friend or maybe a colleague that seems to be feeling suicidal?
You know, it's so important to get people talking.
Yeah.
Get them talking about what's going on, what they're feeling, how they're dealing with it. And it's really important not to shy away from the conversation about, are you feeling like taking your own life? Are you feeling suicidal right now? And you know, there are lots of things you can do to help somebody as soon as they're willing to talk about it a little bit.
Yeah.
But just noticing somebody that's down, that maybe is struggling more than usual, maybe even feeling kind of hopeless, where you kind of start to hear that in their voice or in the things that they're saying.
Yeah.
That's the time to bring it up. Don't be afraid to bring it up.
Yeah, yeah. And just to get them to open up just a little bit, you know, I think can make a huge difference.
Right.
So what is Vera doing to lead community efforts to prevent deaths by suicide?
Well, you know, we've got a lot of things. Number one, we're trying to get the word out, trying to get the message out. We're on the Quad Cities Behavioral Health Coalition and really actively participating with the Quad Cities Zero Suicide Initiative. That's an important initiative. And then also we have the Vera Carroll Center, where we're doing drop-in. Every day people can just drop in to get some help from what we call a low-pressure problem solver.
Yeah.
You know, someone with lived experience who can relate to what you're going through. But you know, the other thing is all of our services are really trying to ramp up our ability to deal better with and help people better with suicidal ideation.
Yeah, you mentioned the Quad City Zero Suicide Initiative. Tell us a little bit more about that and its impact in the community.
So actually we started that just a couple of years ago. And we've got three main goals. Number one, we want to do promotion of a zero suicide. Zero suicide is preventable message for 1,000 days. We're about 700 days into that. Second thing is we want to get 1,000 people trained in question, persuade, refer. People, everyday people who can help somebody who might be suicidal. Then the third thing, we're trying to get 100 organizations on board with the Zero Suicide Initiative. Okay.
And you also mentioned the Carroll Center. So how do the programs at the Carroll Center help prevent suicide deaths?
Well, you know, the Carroll Center is really that place where there are no barriers. Anybody can come in, anybody can get help. We have a free meal every day. We do outreach to the community, to people that are experiencing homelessness. We've got the drop-in center. We have people who are ready to respond to crisis. That's the kind of place where everybody can feel good. Okay.
And what do you want people in the community to know about suicide prevention and the services that you guys provide?
You know, death by suicide is highly preventable. It's something that doesn't have to happen necessarily, especially if we can get the word out so that people who might be feeling that way and not letting anybody know realize that there is help. Treatment is available. You don't have to do it alone. You can actually get help and feel better. And those thoughts of suicide, thoughts of hopelessness, they come and go. And so if we can help people to get through those, and then get on the other side of that and get through their depression, anxiety, whatever's causing those feelings of hopelessness, we can help people survive and get back to their to their life.
Yeah, yeah, and it's great that you guys have all the services that you do available, because it sounds like it's definitely needed here in the community. Dr. Rich, again, thank you for coming in to talk to us today.
You bet. Thank you.
Go ahead.
One more thing. I just want to say 988. Anybody can help. All you have to do is get a person to, with you, call 988 and talk to a professional.
It's easy as that.
It's as easy as that.
I love that. Okay. Again, this segment was sponsored by Vera French Community Mental Health Center. And for more information, you can go to verafrenchmhc.org. We'll also have all those details posted on ourquadcities.com.